Right there, Maria. I mean, it's not the nice one.
And then lower. And also the floor. Awesome. Okay. Okay, starting my assessment now. Hi, my name is Maria. I'm going to be your student nurse. I'm going to be performing your head-to-toe assessment today. Is this a good time for you?
Yes.
Great. Can you double check? I'm simulating a wristband. Can you double check your first and last name for me?
Ashley Medina.
Awesome. And date of birth?
March 21, 2000.
Great. Do you have any allergies, Ashley? Awesome. Okay. So just my general survey of the patient. I don't see her in any distress. She's alert and responsive. I don't see any oxygen delivery systems in use. I don't see her shortness of breath. She looks like she's breathing relatively relaxed. And I don't see any visible lines, drains, tubes, or wounds as I'm assessing her. And I don't see any assistive devices being used. So now I'm just going to be doing an emergency check, equipment. Suction's on and working. Oxygen is on and working. Air doesn't have the Christmas tree, so that's something I will be getting after this assessment. And handy bag is present, so that's good. Okay, Ashley, so do you know where you are? Okay, and do you know why you're here?
For a cough.
Gotcha, okay, and can you tell me today's date?
September.
Awesome, great. And so do you have any headache, dizziness, or fainting? No? Okay, great. Good to hear that. So just looking at the skin, I can see color is appropriate for the ethnicity. It's warm and dry. I don't feel any moisture. I don't see any visible wounds. I'm going to check behind the ears on the other side. And I'm going to check the scalp just because she has so much hair. I'm just going to feel. And no visible wounds. I don't see any lines, drains, or tubes on the head either, or the neck. Now I'm going to be assessing the pupils. So first thing I'm going to do is just check their size. I'm going to shade the eyes a little bit. They look about 4 millimeters inside. They are both equal and round. Can you get a little closer? Okay, going to be okay. Reactivity to light. Okay, both pupils are reactive to light. Now this next part I would normally be assessing without the mask, but because of COVID and the purposes of this head to toe, I will be simulating. I would check facial symmetry by asking my patient to remove their mask and to smile, and then I would be checking for equal movement on both sides of the face. And when they smile, then I would be checking the oral cavity. I would ask them to open their mouth, and I would be checking that the oral cavity is pink and moist. I would be checking for white patches or any lesions on the tongue or any bleeding in the mouth. I would also be checking the teeth to see if any are cracked or if there's any dentures present. I would be noting that. And then now I'm going to have you swallow for me. Okay, no difficulty swallowing there. So now I'm going to be assessing your chest, Ashley. Have you been having any shortness of breath or any chest pain?
No.
You mentioned you had a cough. Is this cough dry, or is it producing some mucus?
Some mucus.
Okay, and what color is this mucus?
Clear.
Clear. And does it have a smell?
No.
No? Okay. And what's the consistency of it? Like
It's really thin.
really thin? Okay. And how much would you say you're coughing up?
Small amount.
Very small? Okay, I will let my nurse know and the doctor know. So now I'm just going to be looking at your chest. So because I took her vital signs earlier, I know that her respiration rate is irregular. Her breathing is within defined limits. Her breathing is regular, as I can see. There's no use of accessory muscles. The depth is normal, and breathing is symmetrical on both sides. And airflow movement is good because the chest is rising symmetrically, and I will be assessing that also with my stethoscope when I'm assessing lung sounds. So now I'm just going to be checking the skin. I'm going to lower your gown just like a little bit. Awesome. And I can see that the skin is appropriate color for the ethnicity. It's dry and warm. I don't see any visible lines, drains, or tubes on my patient. I don't see any visible wounds anywhere. So that's good. For the patient's modesty, I'm going to keep the gown up. And now I'm going to be listening to your heart. So I'm just going to have you breathe normally for me, okay? And so normally I would be taking the gown down further, but for my patient's modesty, I'm just going to leave this up, and I'm going to be showing placement of the stethoscope over the gown so it's easier to see. So I'm just going to be going down about 5th intercostal space, and which is going to be about right here. And then I'm going to be going mid-clavicular line, and I'm going to just lift my patient's breast.
Alright, thank you. So I'm just going to probably leave your gown untied, and then I'm going to pull it back down for you.
Okay. Both pulses are regular and strong, and they correlate to each other. There's no pulse deficit. And now I'm going to be listening to your heart sounds, Ashley. So I'm just going to have you take deep breaths through your mouth, or I'm going to be listening to your lung sounds. So just deep breaths through your mouth. Every time you feel my stethoscope touch your skin, okay? So first I'm going to be going down. Just going to lower this a little bit. First I'm going to be going down about 1/2 inch below the clavicle, avoiding the clavicle.
I didn't hear any abnormal sound, but residual sound, your lung is clear.
Now I'm going to be going down to the xiphoid process and just doing this over the gown as well. And that part I simulated over the gown because normally I would do it on skin, but for my patient's modesty. And just on the sides, I'm going to lower this a little bit, and then 1 inch below the armpit. Okay, great. And then this side. Again, 1 inch below the armpit. Deep breath. Awesome. And once again, I'm avoiding placement on bone as much as I can so I can get a clear sound. And your lung sounds are clear. So now I'm going to have you sit up a little bit for me. Great. Do you want to move over this way? And then we'll see the back. So, okay, I can see that my patient's skin is, color is appropriate for ethnicity. It's dry and warm. I don't see any visible wounds, and normally I would have them take this off, but for my patient's modesty, I'm having her keep her tank top on. I don't see any wounds. I would be assessing underneath for wounds, so the skin is intact. There's no lines, drains, or tubes that I can see. And then I would also be palpating for sacral edema. I don't feel any, but normally I would have them have their shirt off to double check. So now I'm going to be listening to your lungs again. So just deep breath every time you feel my stethoscope, okay? So I'm going to have you put your shoulders back for me so I can feel where the scapula are, okay? So first I'm going to be going above the scapula. Deep breath. Okay, above the scapula on this side. Deep breath. Now I'm going to be going between, shoulders back for me one more time. Okay, now you can relax. Between the scapula and the spine, avoiding both. Okay, now I'm just going to be going underneath the scapula. And normally I would do this on skin, but for my patient's modesty, I'm doing it over her tank top. Deep breath. Okay, and just this side. Okay, lung sounds are clear, which is good. So now I'm going to be assessing your abdomen. So I'm just going to be lowering you down. All the way. Awesome. And so normally I would be doing abdomen. Do you mind if I pull your gown down? Awesome, okay. So I'm just gonna be doing it over the tank top and shorts for her modesty. Have you been having any nausea, vomiting, or diarrhea? Okay, have you been having any constipation? Okay, when was your last bowel movement?
Yesterday.
Okay, do you feel like you're eating regularly?
Yes.
Okay, are you having any trouble urinating?
No.
No? Are you incontinent? Do you feel like you can't make it to the bathroom in time?
No.
Okay, good. So I'm going to be assessing the shape and the look of the abdomen. So I don't see any, it looks very symmetrical to me. It's flat. I don't see any distension or any sort of bulging. I don't see any visible masses, lesions, or any sort of lesions, or pulsations. So first I'm going to be doing is I'm going to be listening in every quadrant and then I'm going to be palpating. So I'm just going to have you breathe normally for me. I'm going to listen for bowel sounds, and once I hear some, I'll move on to the next quadrant. Starting in the right, up, lower.
Let me know if I aggravate while I'm listening, or next I'm also going to be talking. Just let me know if there's anything painful or tender while I'm breathing, okay?
Okay, great. You're having normal bowel sounds, which I heard. And now I'm going to be feeling your abdomen for any masses. So just let me know if you feel any tenderness. Okay. I didn't feel any masses, so that's great. I'm going to put this back in. Awesome. Now I'm going to be assessing. I'm going to bring you back up, and I'm going to be assessing your arms. Okay. Have you been having any numbness, tingling, or pain in your arms?
No.
Okay, great. I can see that the color is normal for ethnicity. I don't see any, it's dry and warm. I don't see any edema, which is great on both sides. I don't see any sort of wounds, no lines, drains, or tubes. Now I'm going to be listening to both of your pulses. Okay, both pulses are strong, equal, and regular. Now I'm going to be assessing capillary refill. Okay, less than 3 seconds. No skin turgor, which is good. And again, no edema. Okay, grip my hands for me. Awesome. Push up on my hands. Awesome. Push down. Great. Strength is equal on both sides. Now, I'm going to be assessing your legs. I'm going to pull you down up from myself. Thank you. Have you been having numbness, tingling, or pain?
No.
Great. They're both legs are symmetrical. Color is appropriate for ethnicity. I don't see any. I'm going to pull your socks off, if that's okay. I don't see any sort of wounds, any pressure ulcers anywhere. She does have a small cut on her knee, so I'm just going to be noting that. It's not bleeding or anything. Both legs are symmetrical. No lines, drains, tubes, or wounds. As I said, just this small little lack on the knee. Now I'm going to be assessing the posterior tibial pulse. I'm going right behind the ankle. Both pulses are strong, equal, and regular. And now I'm going to be going the dorsalis pedis. Okay, both pulses are strong, equal, and regular, as I felt. Now I'm going to be checking out the capillary refill. Great. Less than 3 seconds on both sides. And now I'm just going to have you push down on my feet, hands, and then push up. Okay, now one leg at a time. I'm going to have you raise it. Push up, push down. Great. Push up, push down. Awesome. Okay, that is great. So that concludes, and I'm now just gonna have you stand up and do walk. I'm gonna do the other side. Okay, I'm gonna have you walk. There, I'm gonna have you walk in a straight line for me, real quick. Okay, 5 steps. Okay, no difficulty walking and no good posture and good balance. Now I'm just gonna raise 2 side rails. I'm going to make sure the bed is lowered all the way down, which it is. And I'm going to put the seat up. Is this comfortable for you? Okay. Here is your collet within reach. Just press it if you need any assistance. Here are your belongings, so you have close access to them. And bed is lowered, locked. 2 side rails are up. That is done. This completes our head to toe assessment. I'm going to go document, and I'm going to do my hand hygiene. I'll be back in 15 minutes to check on you. Done.